When I opened the window, it smelled the scent of the earth. It seems the rain that had been falling since last night has stopped, and sunlight is peeking through the clouds. Now that the rain has stopped, it's going to be a busy day. My name is Stephen Carter. I work at a small clinic located in a mountainous region, similar to the Appalachians, which is facing depopulation. It's already been 2 years since I started working at this clinic. I feel like I've somewhat become part of the community here. I remember that when I first arrived, the local folks seemed a bit hesitant about me, as my predecessor had suddenly returned to a university hospital. They probably looked at me thinking, I'll probably go back to the university hospital soon too. I had a strong desire to settle down and dedicate myself to the patients here, and wondered how I could make them understand that. At such times, the one who gave me advice was Erica Johnson, who had been working as a nurse in this clinic since the days of my predecessor. She is originally from this area, and after graduating from nursing school, she worked in another hospital for a short period before returning. She's 2 years younger than me, but she's very responsible. I felt like she was always helping me out during the initial days. Though she seemed upset about the predecessor suddenly quitting, she firmly told the locals that it wasn't right for me to face any disadvantages because of that. She's a hard worker, strict but kind. She often says that nursing is her calling. Moreover, she's famously known as the most beautiful lady in this region. There are even folks who visit this clinic just to see her. I remember being taken aback by her beauty the first time I saw her. She has strong, intense eyes, but when she laughs, her aura changes dramatically. Away from work, she's like a gentle spring breeze. No wonder she's so popular. Good morning. Looks like we're busy today as well. Enjoy the scent of the mountains while daydreaming. It seems Erica has already arrived for work. She's all set and ready. The lady working part-time as a receptionist is Erica's aunt, and she also seemed to have come in for work. Yesterday's rain made it difficult for the elderly to visit the clinic. There might have been patients who felt unwell but couldn't make it. Our intuition was spot on. From morning to evening, the clinic was bustling. We barely had any time for lunch. Fortunately, there weren't any major emergencies, and we managed to treat everyone calmly. As I watched the last patient leave, exhaustion hit me all at once. I went back to my office and slumped in my chair. Sitting on a round stool, Erica, looking equally worn out, smiled and said, "It's been a long day." But we didn't have any complicated cases today. Looking at the towering pile of medical records, I thought finishing up would take us till midnight. She probably read my expression. Shall we postpone Samantha's counseling session for today? Caring about my well-being, that's what Erica suggested. The last medical record left on the table was of Samantha, Erica's younger sister. She's a bit mentally unwell. She goes back and forth between the present and the past in her mind, acting as if she's someone else. Sometimes, she spends the whole day with someone who isn't really there. She needs mental care. After regular consultation hours, I provide counseling. We do this twice a week. It's okay, everything's on track. In response to my comment, Erica lowered her head apologetically. Originally, I worked as a surgeon. I'm new to psychiatry, so I'm learning as I go. Moreover, my patient, Samantha, is a tough nut to crack, showing no sign of opening up to me. After seeing her, I'm often overwhelmed by exhaustion and self-loathing. Samantha, always on time, I see. The clinic door opened quietly, and Samantha, pale-faced, walked in. It seemed she couldn't hear Erica's voice at all. Her pale complexion was a usual sight. She sat emotionlessly on the round chair after Erica left and looked straight at me. "Samantha, it was a beautiful day today. Anything new happen?" In response to my question, Samantha shook her head. Then she smiled, just with her lips. "Don't always ask about me. Tell me about you today." She looked up at me, her chin resting on her crossed legs. If Erica is a gentle spring breeze, Samantha is a harsh north wind. She always seems to be challenging something, tough on herself and others. About me, I unintentionally echoed her question, and she nodded slowly. Encouraged by Samantha, I began to tell my story. There's a reason I chose this clinic. Back when I was in mid-school, I got caught in a slip and fall accident near this clinic. The doctor who treated me back then was the previous doctor of this clinic. After first aid, I was airlifted to a major hospital. According to the doctors at the hospital I was transferred to, I was told there would be no lingering effects because of the initial treatment I received. I had to take a year off from college, but I've been fine since, with no after effects. I heard that the previous doctor suddenly quit, and the clinic was in need of a doctor. I applied to work here as a way to repay the favor. Well, really? So, you know about Liam? As I talked about my past, Samantha squinted her eyes. Liam was my predecessor. There were a rumor that he and Samantha were romantically involved. It was said that her mental disturbance began when he suddenly left her. Samantha seemed to be having a good time chatting and dating with Liam, who wasn't present. It seems she's started to retreat into a world of fantasy. The reason Erica asked me to give Samantha mental care was that these occurrences became frequent. Samantha seems completely unaware of her actions. You didn't graduate with your peers, did you? What were you doing after? You didn't come straight here after graduation, did you? I nodded and explained the reason. After graduation, I immediately joined a medical mission abroad. Being invited by a senior was one reason, but I also wanted to see the American medical care from a bird's eye view of the world. Every hospital has its politics. The prestige of the university you graduated from can set a pecking order in society. One of my peers was the son of a renowned medical professor. His name is Max. I heard he's currently working at a university hospital. Max would flaunt his father's position and look down on other peers. Overseas medical missions are possible if you have a medical license. After gaining a lot of experience abroad and finally gaining some confidence, I decided to return to the States. That's when I chose this clinic. I always thought you were an oddball, but you're interesting. That day's counseling session ended in a way where it was hard to tell who was the patient and who was the therapist. In the end, I couldn't get any information out of Samantha. Watching her leave from the front door, a thought struck me. I questioned if Samantha really has a mental illness. Interacting with her a few times, I realized she's sharp-minded. She can foresee the course of conversations and loves delving deep into matters. She might just be pretending to be mentally ill. But then the question arises, why? The past month felt like being pulled around by her. During those days, I received an unexpected invitation from the city. There was a request to share my experiences from my overseas medical mission in a lecture. The invitation also mentioned that some of my university peers would be speaking. It felt like a good opportunity for a reunion. I consulted with Erica and decided to take a couple of days off from the clinic. For me, I'm a special guest. The lecture felt laid back. Dr. Stephen, I heard you're heading to New York after a long time. I have some errands around the same time, so I could give you a ride. Samantha said this during our post-treatment counseling. She usually rides a big motorcycle. She said I could ride with her since she had her own errands. Although it seemed a bit scary, it might be a good chance to get closer to her. Maybe I'll take you up on that offer. When I said that, she laughed and told me, "Don't be scared." Turns out, I was scared. By the time we got there, I was so stiff with fear. I swear it's not because she's a bad or reckless driver. It's just that I'm a scaredy cat. I've never ridden a motorcycle before, and the idea of a petite woman like her handling such a big, heavy motorcycle was unnerving, I suppose. But despite my worries, she handled the motorcycle as if it were an extension of her own body. We reached our hotel in no time. She helped me off the bike at the entrance. "I'll come pick you up for the ride back," Samantha said before she left. Samantha said she had something else to do, so perhaps she was in a hurry. The next day, I arrived at the conference venue and was taken aback. I had assumed it was going to be a small-scale event, but it was packed with college professors and young doctors. I even spotted some of my medical school classmates. Because I had to take a year off due to an injury, I graduated a year later than everyone else. I remembered a friend telling me that some people thought I had dropped out midway. I really didn't want to bump into anyone troublesome. So, I decided to focus on my presentation. My speech went well, and the organizers even praised it, so I was relieved. That's because the speakers before me were college professors and prominent young doctors. I was sweating bullets from start to finish, wondering if it was all right for me to be the grand finale. The organizers asked me to attend a social event that night. The venue was the hotel's large hall, and it was going to be packed with medical professionals. And sure enough, the social event was swamped with people from the medical field. It was a standing buffet, so I quickly made myself scarce. I was hoping to enjoy some good food unnoticed and leave early. But there are always those who have a keen eye, and I was spotted by the last person I wanted to see. "Hut, is it okay for you to be lounging around here? Isn't your clinic in the middle of nowhere?" the man asked in a mocking tone. It was my old classmate Max from university. A guy I didn't like, who always flaunted the fact that he was the son of a university professor. I heard he's currently working at a university hospital. "Long time no see. I've closed the clinic for 2 days. We don't have any severely ill patients right now," I replied. "Well, it's water under the bridge now." Doing my best to keep a smile, I started making small talk with Max. Slowly, our old classmates started to gather around us. Surrounded by familiar faces, the conversation flowed. When I was asked to elaborate more on my presentation, it turned into a Q&A session. Max didn't seem to like that. He crossed his arms and started tapping his foot impatiently. And he didn't bother hiding his condescending attitude, frequently interrupting and making light of my responses. Gradually, my colleagues started to get fed up with Max's attitude. When an old friend I haven't seen in a while asked about my current job, I honestly told him it was a clinic in a remote mountainous area. "Well, you were the guy who almost dropped out of college. Guess you couldn't handle a big hospital, could you?" Max never missed an opportunity to chime in. "There are more raccoons than people there, right? Half the patients you see are probably raccoons, aren't they? But hey, if there's a serious case, they just airlift them out, so it's the perfect job for someone with your lack of skills," Max said, raising his voice intentionally. It was painfully obvious he was trying to embarrass me. I didn't even have the words to respond. Arguing would just encourage him, so I just glared at Max in silence. Then someone stepped between Max and me. I think people who don't understand how busy mountain clinics are should keep their opinions to themselves. Seeing the man who had stepped in, Max's face turned pale. I recognized the man as well. Dr. Liam. This guy was in the same year as me, but he stopped showing up for training, and now he's parading around as a doctor and even giving lectures. Can you believe that? The man, apparently a higher-up at the university hospital and Max's boss, was speaking negatively about me, but his tone remained polite. Dr. Liam looked at me and smiled slightly. It seems he remembered me. "It's been a long time. Thank you for saving my life back then." As I began to bow in gratitude, Dr. Liam waved it off, saying that thanks weren't necessary. He said he was just doing his job, and he was more grateful to see me doing well. Max was shocked to discover that Dr. Liam and I knew each other and seemed at a loss for words. He didn't want to put his foot in his mouth any further. "Max, he was your classmate, right? But you guys graduated before him, didn't you?" Dr. Liam asked Max, seeking confirmation. Max nodded. He stopped coming to training midway, pointing fingers at me. It felt like he was comparing me to a soldier who had deserted the battlefield. It was frustrating. Everyone has their own reasons. Max, have you ever observed one of his surgeries? When questioned, Max shook his head. Dr. Liam said, I see, with a sigh. Even if you give it your all, Max, it'll take you at least 5 years to reach his level. Max looked completely dumbfounded, not understanding what he was being told. I was also surprised, wondering when Dr. Liam had observed my surgery. Abroad, I had been in disaster zones and war zones, where time was of the essence. Probably, following experienced surgeons had honed my skills faster than I realized. Unbeknownst to me, professors from the university hospital had gathered around us. One professor who seemed familiar with me told Max, "Mind your manners." Max looked flustered, having never expected the professors to hold me in such high regard. It's okay, we were college buddies. When I said that, the professors seemed to understand, saying, if that's the case. In the end, surrounded by friends and professors throughout the party, I was far from a wallflower but ended up pretty exhausted. Talking with friends who work as professors and doctors, I realized that the educational elitism is still pretty bad. My friends seem pretty fed up with it too. Despite their skills, just because they graduated from a regional medical school, they often get fewer opportunities to perform surgeries. Some of my pals are really torn up about it, feeling that these decisions are made with the patient's best interests in mind. By the time the party wrapped up, I had a pretty clear mental map of the politics of the medical community. Outside the venue, high-ranking professors were being ushered into Texas in order of their status. I just watched from a distance. It's a clear hierarchy, isn't it? This is the state of our university hospitals and the medical community. Bootlickers rise to the top regardless of their actual abilities, and those areas that genuinely need medical attention are ignored. I mused. I noticed people obsequiously bowing to Professor Jacob, who happens to be the father of Max. Max stood beside his father, acting all high and mighty. It's not exactly hereditary, but it seems Max will be the one to take Jacob's place. What a joke. I unintentionally blurted that out, and Professor Liam chuckled in response. I transferred from a rural clinic to a university hospital to change this very system. I realized I couldn't do much in a secluded clinic. If you don't remove the pus from its root, it'll keep coming back, he said. He explained. So you explained this to Samantha before leaving that clinic? I asked. Dr. Liam looked at me with surprise. Huh? Ever since you left, Samantha's been mentally unstable. I was about to voice my complaints when he interrupted. That's absolutely not possible. He was adamant that she would never become mentally unstable. His response was so strong it left me stunned. Surprise. Suddenly, a slender arm draped around my shoulder, and it was Samantha's voice. I turned in shock to see an emotionless Samantha hugging me from behind. She wouldn't get hurt just because I left. Samantha's not like that, Liam said with a somewhat troubled expression. While I stood there, too stunned to utter a word, the two of them exchanged greetings like long time no see. It didn't seem like they were former lovers meeting up again. For starters, this guy isn't my boyfriend. Samantha pointed at Dr. Liam, saying that. The doctor nodded in agreement. Yup. So, then, I just wanted to talk with Dr. Stephen. Samantha explained with a cheeky smile. She told me with a chuckle that she had played a bit of a role because she wanted the chance to speak with me. Samantha is actually a philosopher by training. She's always been a bit odd. Samantha puffed up her cheeks. That's just prejudice. For me, that wasn't the issue at hand. Even though Samantha had come to pick me up, my mind was still in a whirl. Hey, Stephen, would you help me out at the university hospital? I thought I could manage on my own, but it's becoming too much. Dr. Liam was asking as casually as if he were inviting me for a walk. And he wasn't just asking me to work at the hospital. It was as if he was inviting me to take down a massive barrier together. A few days later, I was at the clinic. The only difference from before was a pile of cardboard boxes filled with my stuff. Samantha, who supposedly didn't need my counseling anymore, showed up again. Through the gap in the exam room curtains, I saw her sneakily wrapping an old-fashioned medicine bottle in cloth. Whoa, the sight made me blurt out in surprise. Surprisingly, she was trying to wrap an old-fashioned medicine bottle in a cloth. Realizing she was caught, she clicked her tongue lightly. "What are you doing? I just wanted it." She probably wanted the vintage medicine bottle. I knew she had a thing for retro stuff. "You can't take that. The next doctor might need it, right?" But Samantha cheekily puffed up her cheeks and called me a tightwad. "Your departure is tomorrow, right?" After some contemplation, I had decided to accept Dr. Liam's offer. I felt that to make a significant change in the current medical world, we'd have to tackle the core issues. Turns out, my successor is none other than that Max who apparently threw his hat in the ring. I got a call from him to let me in on what I didn't know. Surprisingly, Max has been really engaged with healthcare in his own way. Makes you realize you never truly know someone until you get to know them deeply. Erica decided to stay at the clinic as a nurse. "If you came along with me, you'd be worth 100 people," I mused, trying to convey feelings I hadn't shared till the very end. I wanted to put it more eloquently, but this was the best I could muster right now. To Samantha, it seemed like she could see right through me. She didn't even look surprised. "If in 3 years, you haven't become a puppet to power, you learn the right to woo me." With a firm point at me, Samantha made her declaration. "What? Just the right? Just the right? Who knows where we'll end up from here? But I know I need her in my life going forward. For now, I'll just do my best until the day I've earned the right to woo her." "So, when did you start liking me?" With mischievous eyes, Samantha looked right at me. "I'll confess when I've earned the right to woo you." To my reply, Samantha laughed heartily, saying, "You got me there."